Okay, Sonali also asks, are there any patient attributes that make it difficult for you to perform manipulations? For example, an overweight or elderly patient. Well, as I said before, every patient is different. So when I do the exam, when I check the patient, see what's going on, whether the patient has very limited range of motion, if the patient's in a lot of pain, if the patient is obese. Now, sometimes I've had patients that were so overweight that I couldn't even reach around them to do the adjustment I usually do for the lower back. And because of that, I have this table, for instance, which has segments that drop. So the section drops only a fraction of an inch, but we can get the joint to move. I also have an instrument that vibrates the joint loose. So there are a lot of ways around it. And everybody gets, like I said, a different kind of treatment. You don't treat a person who's 80 years old the same way you would treat a 30-year-old. And you don't treat a 30-year-old the same way that I would treat a 5-year-old. And yeah, I do adjust 5-year-olds in my office. They get a much different kind of adjustment than an adult. So yeah, you have to tailor the adjustment to the patient. And yes, some patients are can be challenging in the sense that you might have a young person who's, say, a 90-pound woman who's very flexible, does a lot of yoga, but there's one area of the spine that doesn't move. They can be difficult to adjust because you can't get everything's so mobile that it's hard to get to that one joint that's really difficult. On the other hand, I'll get like a 250-pound football player and adjust them easily because their spine, it happens to be easy to adjust. Sometimes you use the person's weight to your advantage, where you can start the motion going and you overcome the inertia easily because they have a lot of weight and you can push and get things to move. So it's a matter of finesse, and it's a matter of not making the patient uncomfortable, to do it in as comfortable an adjustment as you can do. And also for the chiropractor, you don't want to hurt yourself because then you're not going to be able to help anybody. So there's a lot of different tricks and techniques to take the whole gamut, the whole variety of patients. I haven't seen any patient that I haven't been able to work on to some degree over all the years I've been doing it.